So today's my first day of taking 10 milligrams of trintellix to treat anxiety. I have generalized anxiety, although to me personally it feels more like social anxiety because I feel like I'm most anxious in social situations. But at the same time, I always feel some degree of anxiety no matter what situation I'm in. So I guess when you look at it that way, generalized anxiety disorder makes sense. Um, Trintellix is mainly used to treat major depressive disorders, although there have been some studies and based on some research that I've done, it also does show benefits for treating anxiety, which is what I'm mainly focused on treating lately because my anxiety has been off the charts. So I really want to do something about that. My psychiatrist started me on a low dose, 10 milligrams, because I do have tend to have a sensitivity to medication. Um, and I decided to take it at night. And I'm also taking 60 milligrams of strattera to treat inattentive ADHD. And I've been taking the strattera for about a month now. And I've just recently started to see some improvements in my ability to focus. And um, I was previously taking strattera in the morning, but I've noticed that it does make me nauseous when I take it in the morning. So then I've started taking it at night. So I'll be taking the 60 milligrams of strattera and the 10 milligrams of trintellix together before bed. And with strattera, I've mentioned this before, it does curb my appetite quite a bit. Um, and so I just recently started taking it at night, but when I would take it in the morning, I would take it with breakfast and then I just wouldn't get hungry for the rest of the day. And I know it's the strattera because uh, today I actually forgot to take it in the morning and I was feeling hungry throughout the day, like normally, and it was weird for me because I'm not really used to feeling hungry anymore. And then I realized, oh, I didn't take strattera this morning. I forgot to take it. And so then I just took it about 2 hours ago with the trintellix. And then, like about 3 weeks ago, when I first started, or about a month ago, the first week that I was on strattera, I forgot to take it. One day I forgot to take it, and then I realized afterwards because I was feeling hungry. So, like, the hunger is kind of like the cue or the hint that kind of reminds me that, hey, you didn't take your medication today because whenever I do take it normally, I just don't feel hungry throughout the day, which I guess is one of the side effects. And I have lost about 3 or 4 pounds in about a month since I've been taking strattera. It's not intended for weight loss, I don't think. But I really don't mind because I do want to get back to my normal weight. And if you've been watching my videos, I've mentioned this a couple of times that I gained a lot of weight while I was on Zoloft a couple of years ago, and I have not been able to go down back down to my normal weight since then. And that's one of the things that people say about medication weight. It's that it's really hard to lose it once you've gained it for some reason. I have tried exercise, dieting, just a bunch of stuff, and I just can't seem to lose the weight. And I started taking strattera, and I'm starting to lose some weight and starting to see some improvement in my focus, which is great. Um, so, like I said, today's my first day taking trintellix, and I hope that it will help with my symptoms of anxiety. And in my previous video, I talked about how I've noticed that I hold my breath a lot when I'm talking, when I'm around people, inadvertently, I just don't notice it. I just kind of do it. And doctors and even my therapist have pointed this out to me, that I don't seem to take normal breaths and that when I am breathing normally, it's not really normally. My breathing is very shallow. And that's one of the symptoms of anxiety, of course, short and shallow breaths. And so getting my breath under control because your breath is really connected to everything. Getting my breath under control is one of my main goals, and I am trying deep breathing exercises. And I also recently bought this incentive spirometer, and it was like $7 on Amazon. And I bought one for me and one for my mom because she got COVID last year and she has had trouble breathing ever since. So she still has some lung issues. Anyway, the way that this works is like you breathe in and then breathe out. You kind of watch this little thing rise and fall as you breathe in. You watch it rise, and then it tells you on here like it has measurements of how many milliliters you've inhaled, and then you can mark it so that you can try to do better the next time. And the goal of this is to strengthen your lungs. And doctors sometimes use it for patients who have had surgery or who have lung problems, and even speech therapists. That's my career goal is to become a speech therapist, and they sometimes use it for clients or patients who have had or have lung conditions, because when you can't get enough air, the lungs are kind of the powerhouse of speech. And when you can't get an adequate amount of air, sometimes it's difficult to speak. And ironically, I don't think that I really get enough air to my lungs. And I think that it's been this way for so long, but I'm just now starting to kind of notice what a problem it really is. And I really think that it's also connected to my anxiety. So I think that if I was able to kind of get control of my breathing, um, then my anxiety wouldn't be as bad. So, yeah, ultimately, my goal is to learn to take normal and deeper breaths and kind of notice when I'm not breathing and start breathing. Sounds simple enough, but since I've been doing this automatically for as long as I can remember, it's more difficult than it sounds. So I really have to kind of be aware of my breathing and notice when I'm breathing shallowly, which is difficult because I feel like that's really the only way that I know how to breathe. So hopefully the incentive spirometer that I bought will help with that, and that the medications that I'm taking will also help with calming some of my anxiety. And I will come back in about a week. Yeah, so normally I do like weekly updates, and I'll also keep doing my weekly strattera updates. And yeah, guys, don't forget to breathe.